Good morning, everyone. Thank you so much for being here in my live podcast. Today's session is all about how you as a parent and teacher can respond effectively when a child suffers a broken bone or sprain, using nothing more than the item around you. This isn't a medical course. You don't need a stethoscope or fancy tools. You just need your presence of mind, a little knowledge, and maybe a scarf or a ruler. I am Rafida Mitikandam, matriculation number 8205071052280001. I am a student from Faculty of Technology and Applied Science, pursuing Bachelor in Nursing with honour at Open University Malaysia, Petaling Jaya Learning Centre. Alright, let me paint a quick picture. It's recess, the kids are running, climbing and laughing, and then suddenly there's a fall, a loud one. A child is crying and clutching their arms. No first aid kits inside, just a school bag, some tissues and maybe a half of sandwich. Alright, so now what? Today's talk is all about turning the panic into power. Knowing how to act quickly, calmly and wisely in those first critical moments when a child suffers a broken bone or sprain, especially at school. We, as a teacher, mother or father or anyone have to react fast to calm and give comfort situation before medical treatment arrives. The first few minutes after the injury are crucial. Acting wisely. First, help reduce pain. Second, prevent further injury. And third, give comfort and security to the child. And again, you don't need medical tools. You already have what you need around you. Okay, now, let's talk about how to tell the difference between a fracture and sprain. A fracture or broken bones usually means sharp pains, especially when trying to move. Second, swelling and bruising. They may look sharpened or deformed. Third, the child can't or won't move it. And the last one, in some cases, bone sticking through the skin. How about the sprain? A sprain involves stretch or torn ligament, pain around the joint, swelling and bruising. The child can still move the joint a bit and no obvious deformity. But if you never unsure, treat it as a fracture until proven otherwise. So what should you do now? Can anyone give me the answer? Okay, first thing you need to do is, first, stay calm. Second, ensure the area is safe. Third, call for help. You can call ambulance, school nurse or emergency service. And the last one is reassure the child. Say things like you are safe or help is coming. This reassurance is powerful. It reduces fears and keeps the situation under control. Now, here's where it gets creative. Let's say you don't have a first aid kit. No problem. Look around and there are tools everywhere. First, maybe you will need a ruler, magazine or notebook like this. Can act as a splint. And then you need a scarf or shoelace. Can be used as a tie or secure. And then you need a sweater or jacket. Can become as a cushion or sling. And you can have a backpack. It's perfect to raise and injured legs and arms. You already carry first aid kits. It's in your bags, on your desk or even around your neck. Alright, ladies and gentlemen, I will demonstrate to all of you how to make a splint. First, gently support the limbs in a position you find it. Do not try to straighten it. Second, place a hard item next to it, like a book, a stick, or a ruler. Second, use a tie example as shoelace or necktie, to secure it gently. Another one tie, make it secure. Ensure it's not too tight. Check the toes for warmth and color. Alright? This is a simple action, prevent further damage and buys time until medical help arrive. If the injury is the arm or shoulder, a sling gives a great support. How to make a sling? First, gently place the arm across the chest, like this. Alright? And then, use a scarf or a long sleeve to support the wrist and elbow. So here, I have a scarf, which is I fold into triangle and then put under the arm. Alright. Just cross like this. Okay? And then you have to tie at the back. While waiting treatment from the emergency, so you have to support this hand and immobilize this hand. At the same time, you have to check the arm or the nails, whether the color and the warmth is still present or not. Alright, so you can support with the jacket under the hand and wait until the emergency treatment comes. Alright, for sprains, remember the acronym of RICE, which is RICE. R stand for rest the joint, no movement. I stand for ice, with a water bottle, ice pack or anything cold. C is compressed with a scarf or bandage to reduce the swelling. And E, elevate the limb on a back cushion or even your lap. Alright, like this. We have to elevate the legs on the back or cushion, and then you have to put an ice with the towel and compress at the legs to reduce swelling. But you have to remember, you must call for help immediately if there's a visible deformity, the child can't move the limb, the area is cold, pale or numb, the child is severe pain, and a bone is sticking out. Trust your instinct. When in doubt, call for help. You can never be too careful when it comes to children. Alright, and finally, when you say matters just as much as what you do. In those scary moments, a child looks to you not just for help, but for comfort. Say things like, I'm here for you. We are going to take care of this. You are doing great. Help is on the way. This word can calm the child and give them strength. It also keeps others from panicking. Alright, so let's quick recap. You have to remember, first, you have to stay calm. Second, use what around you like books, scarf and shoelace. Third, immobilize the injury. Fourth, comfort the child. Fifth, call for help when in doubt. You don't need medical degree to help. You just need to care. And from the looks of this room, I know we have got plenty of people who do. Thank you so much for your attention and for your showing up today. Whether you are parents, a teacher or both, you are also protector, a first responder and comforter in emergency. In the face of child's injury, your calm presence and creative thinking can truly make a life-changing difference. Let's continue to learn, stay prepared, and take care of each other. Thank you. Bye.